We really want to promote in the newborn period that parents get in the habit of putting their infants on their back to sleep. That cuts the rate of SIDS in half. We know that early on, parents often will have a baby with them. That's not the most safe environment, although there are co-sleeper devices that can be put right adjacent to the bed attached to it so that it can still allow that intimacy for the family. Usually I recommend at about a month of age or so to actually then transition the baby to a nursery. If infants are in the room for too long, that they do tend to wake up more. Parents respond to them probably when they don't need to be responding to their cues, and that can end up leading to more sleepless nights. The other thing I really try to encourage parents to do is allow their infant to get in a habit of putting themselves to sleep within the first month or two. If we can train our children to fall asleep on their own, then they'll be better sleepers. The only strategy we know is going to involve some crying, and nobody wants to hear that. Most parents don't realize this is a 3 to 5 day proposition and they're done. So short-term pain for long-term gain. I tell parents, you know what, your infant knows that you love them. You love them all day long. It's okay at night. They're not going to be traumatized in the long run. Before you start this strategy, you better sit down as a couple and make sure you're on board with each other, because the worst thing to do is have the baby cry for, you know, an hour, and then all of a sudden one of the parents becomes the rescuer. Then the infant doesn't learn anything positive by that, and the parents are just glaring at each other in the middle of the night. I think it's important that our children learn how to calm themselves down, how to take care of their own situation whenever they can, because ultimately they're going to grow up and be adults, and that's what we all need to be able to do. And I think we all know adults that don't do a very good job of that. So as parents, I think, again, we can feel better about what we're doing in that stage if we realize we're not only solving an immediate problem, but we're teaching a good life skill to them.